Have you been trying to get pregnant for months now? And do you start to worry? Then this video is for you. Here we will cover all the tips and tricks on how to get pregnant, how to increase your chances, and when to visit a doctor for a medical examination. Hey there, and welcome back to How to Medicate, and welcome to this video on how to get pregnant. This video is part of a video series on sexual problems, and for those of you who want to keep on learning after watching this video, of course, check out the playlist in the description. My name is Raoul, I'm a medical doctor from the Netherlands, and I'm making weekly medical videos to educate myself as well as you, my viewers, because I believe that medically educated people make healthier decisions, which is the whole point of this video. This video also comes with a quick disclaimer. It's meant purely informative. This is not medical advice, and if you're looking for medical advice, always contact your own doctor. And now quickly, let's get learning. Now to start off, let's start with the question, what is pregnancy and how do people normally get pregnant? To put it bluntly, pregnancy or gestation is the time it takes for one or more children to develop into the womb of a woman. This all starts with the ovulation, which is the release of an egg cell in one of the woman's ovaries. An egg cell is then typically released into a fallopian tube, which connect the ovaries to the womb. The ovulation typically occurs on the 13th to 15th day after the first day of your last menstruation. This is also called a woman's fertile period. And if unprotected sexual intercourse takes place right before or after the ovulation, this can lead to the fertilization of an egg cell. For this to occur, the sperm cells need to travel through the vagina into the womb, into one of the fallopian tubes where the egg cell is located. And one of these sperm cells then needs to unite with the egg cell, after which the pregnancy starts. And if you would have unprotected sexual intercourse around your fertile days, most couples will get pregnant within a year. In fact, 84% of them will get pregnant. However, on an individual basis, it's impossible to predict which couples will get pregnant and which won't, because this depends on many factors. Your general health, your reproductive health, your age, how often do you have sex, and many more factors. Unfortunately, fertility problems are very common and are seen in about 1 in 7 couples. In 40% of these cases, there will be a problem with the woman and the man, and in 25% of these cases, no actual explanation can be found for the fertility problem. And more often than not, a fertility problem is multidimensional. However, the most common causes are either sperm disorders or an ovulation failure. Both can be caused by lots of factors, including physical disorders like obesity or anorexia, hormonal disorders like PCOS or thyroid problems, or reproductive disorders like infections, a blocked fallopian tube, or a low sperm count. So in a nutshell, it's normal to try to get pregnant for 1 to 2 years. Some women get pregnant quickly, while others take much longer. It may be upsetting, but this is normal. However, there are some tips which might help you. First of all, if you and your partner are ready, it's better to start trying when you're younger, as a woman's fertility declines with age. 92% of women between 19 and 26 years get pregnant within a year, while only 82% of the women between 35 and 39 years does. In addition, this effect of aging on a man's fertility is less clear, but seems to be less of a problem. Furthermore, you are most likely to get pregnant if you have sex 1 to 2 days before and after your ovulation. And as mentioned, this usually happens the 14th day after the first day of your last period. And once released, an egg cell can live up to 24 hours, but during this time it needs to be fertilized. Sperm cells, on the other hand, can live up to 7 days inside the womb. Another rule of thumb could be to have sex every 2 to 3 days. This has the benefit that you do not have to time the ovulation. The next tip: maintain a healthy weight with a BMI between 20 and 25 and exercise regularly. Then quit smoking and quit the consumption of alcohol. This is not only important for women, as both can be dangerous for your unborn baby, but it's also important for men, as both can decrease the quality of your sperm. And the same is true for several prescription drugs as well as recreational drugs. Therefore, always discuss this with your prescribing doctor. Now, if you used all the previous tips and you have been trying for 1 to 2 years and you still can't get pregnant, then it's time to visit your doctor for a medical examination. And here's important to note that for men and women older than 35 years old, an infertility evaluation could already be useful after 6 months of trying. Now, I hope you know now how to get pregnant, but if you have any questions, let me know in the comment section below. And for those of you who want to keep on learning, check out the playlist in the description. All that rests me is to thank you all for watching and thank my sponsors on Patreon. Thank you Sebastian, who is an investor tier supporter. And for all of you that did learn something, please leave a like. This will help out the video tremendously, and consider subscribing. I'm making weekly videos to educate myself as well as you. And by subscribing, you could help the channel to reach 20,000 subscribers. I also made an Instagram account. You can find it up here, and I'm posting there pretty much daily. Thank you all for watching, and as always, I will see you next week with a new video. Bye bye.